Welcome and thank you for joining us for the Grantmakers in the Arts webinar, Arts in Medicine, Supporting Artists Working in Healthcare Settings. I'm Janet Brown, President and CEO of Grantmakers in the Arts. For the month of July, GIA is focusing its online programs on topics related to the arts and well-being, including using healing arts with military personnel and engaging the creative lives of older adults. Today's session continues GIA's exploration of arts in medicine, a topic we began spotlighting earlier this year with an extensive literature review commissioned by Dr. Gay Hanna, an Arts in Medicine Funders Forum held in Orlando in February, and 3 topical articles published in the latest edition of the GIA Reader. Information on all of these are available on our website. Since GIA exists to serve you, the funding community, and today, I guess, everyone who's interested in arts and medicine, it is our intent that this exploration inspires you to consider ways to deepen your own organization's support of artists working in medical and healthcare settings. We're happy to have joining us today Patricia Lambert, Professor of Cultural Policy and Arts Management in the Department of Planning, Public Policy, and Management at the University of Oregon, and she is also the author of a book entitled Managing Arts Programs in Healthcare. And also Jill Sonke, Director of the Center for the Arts in Medicine at the University of Florida, a 30-year-old arts and healing program. Patricia and Jill participated as thought leaders at the Funder Forum earlier this year in Orlando, and we are excited to welcome them back on this webinar platform. After their presentations, they will be available to answer your questions. To share your questions, you can type them onto the rectangular text box at the bottom of your screen at any time during today's session. And I will come back after they've presented to facilitate the Q&A session. I also want to let you know ahead of time that this whole presentation is being recorded, and you will be sent a link afterwards. So if you see slides that you're really interested in and you want to make sure that you keep, you'll be able to get a copy of those and have those for yourself after the session is over. And we'll send that along with an evaluation, which I'll remind you at the end also. So with that, I'll turn us over to Jill Sonke. Welcome, Jill.
Thank you, Janet. I'm delighted to be here with you all. So I am going to present this afternoon the Arts and Medicine programs at the University of Florida as a model of one of the many arts and health programs that have developed in the United States. What many of you may know already through the wonderful work that Gay Hanna has done is that there are quite a few programs now in the United States that are using the arts in the service of health, both in healthcare institutions and in communities. The Joint Commission, the National Accreditation Association for Arts and Health, has assessed prevalence of programs a couple of times for us in the United States, and in both of those instances they've found that about half of hospitals in the United States have arts programs, which is very exciting. Our program at the University of Florida was established in the late 1980s, so we were one of about 5 programs that started at that time. And we've grown to be one of the most comprehensive programs in the United States now among many, many incredible peers. But I'll offer our program today as an example of a fairly comprehensive program and as one that merges in a very unique way a health sciences center, a university-based hospital, and a university program. So what you'll notice on this slide is that the arts and medicine programs at the University of Florida are the UF Health Shands Arts and Medicine program, and that's our clinical program, and the UF Center for Arts and Medicine, which is our academic and research program. So I'll give you a little bit of an introduction today to the center, but mostly I'm going to focus on our clinical program. But to put those 2 programs in context, you'll see on this slide a little bit of an overview of our programs, and what you see is the unique connection of the Center for Arts and Medicine and the UF Health Shands Arts and Medicine programs as 2 halves of a whole. In these programs, we're able to undertake education, research, outreach, clinical services, and to address the environment of care. And as I introduce the program to you, I hope you'll notice the ways in which all of these aspects of our program are working together. So the UF Health Shands Arts and Medicine program, as I mentioned, was established formally in 1990 after a couple of years of grassroots development here at UF Health Shands Hospital. Over those years, we've become a full department of the hospital. So we have an annual operating budget. We have an endowment now, which we're very excited about. We are supported by grants, and we have a wonderful base of donor support. We, as a department, report directly to the CEO of the hospital. We're very fortunate also to have prime real estate in the hospital. We have 1,400 square feet of space on the main floor of our hospital, and an administrative staff of 5 people who help to coordinate the program, and we now employ 21 professional artists and residents in the program, as well as 4 creative arts therapists. So our program also represents a really unique blend of those 2 disciplines, arts and health and the creative arts therapies, working very much together in the clinical environment. Our environment is a big one. We have over 1,000 patient beds now in our hospital between 2 towers, and we have a 3rd tower opening in just a few months, so we'll climb up to about 1,200 patient beds. And our artists and residents are able to provide over 18,000 one-to-one bedside visits per year, and our program, including our installations and exhibits, serves over 1 million people a year. So over these 3 decades, we've really grown to become quite a comprehensive program that provides a lot of services in our environment of care. The Artists in Residence program is the heart of our program. We have professional artists and residents who are paid to work on our staff. They work anywhere between 8 and close to 30 hours a week. And they're artists in music, in the visual arts, in writing, in dance, and drama. And of course, some are very unique interdisciplinary artists. One of our artists is a spoken word artist, for instance. So each of those artists is developing practice in the clinical environment, bringing their art form to patients one-to-one at the bedside, facilitating creative opportunities. They're also attending to family members and to professional caregivers in the environment and conducting workshops. So they're gathering patients and family members and staff in public spaces as well. We also have quite a robust performing arts program. The National Endowment for the Arts has helped us over quite a few years to bring in incredible visiting artists to our hospital, to provide performances for patients and family, and to really enliven the environment of care, both at the bedside and in public areas. We also contribute really substantively to the environment of care, and this is really a mainstay of the discipline. Many hospitals around the country and around the world are investing significantly in the arts as a means for really enhancing and humanizing the environment of care. In this image, for instance, you see our pediatric emergency department, and this is the view from the front door. So when our pediatric patients and their families walk in the door, they don't see images or symbols of a hospital. They see images of nature, and they see a very playful, welcoming environment. So we're very fortunate to have an arts and medicine program that's established to the point where anytime a design, a renovation, a build happens, arts and medicine is at the center, and we're able to design the environment very significantly around the arts. So we do have permanent installations as well as impacting design and rotating exhibits. This is an example of an interactive visual art exhibit. It allows children in our pediatric hospital's main lobby to make art and make music. All of the symbols that they choose make sound. And what you see in this slide is a photograph above the patient bed. And this is a project that Tina Mullen, who's the director of the UF Health Shands Arts and Medicine program, implemented when this tower was built about 8 years ago. Rather than taking the standard construction budget, which allows you to put poster art in patient rooms, Tina put out a call to staff, everyone who works in the hospital, for photography. And she received over 1,000 submissions, and a committee selected about 250 works. And so now in every patient room in our hospitals, we have original works of art that were created by staff. And there are little plaques that identify those staff members. And the project is brilliant in so many ways. It utilizes a very basic budget to allow for original art rather than reproductions or poster art, and it also gives caregivers a way to be a part of the clinical environment, and it helps patients also to see their caregivers as artists, which really can change that relationship as well. And also in our Children's Hospital lobby, like our other two lobbies, you walk in and you're welcomed by major art installations. This one is unique in that it introduces the wayfinding scheme for our entire Children's Hospital, where the art and the design on every floor moves up from the bottom floors, which are underwater, through our forests and prairies, up into the sky on the top floors. So the images from this work of art are repeated through the hospital as a part of the wayfinding system. We also just put art everywhere we can. So we see a blank wall outside or on a roof, and we mural it. So again, it creates an incredible environment of art and vibrancy in the hospital. We also have a wide array of programs in our community. So our artists and residents are working in a variety of community locations to promote wellness and well-being in the community. This is one of our 4 weekly dance programs for older adults in the community. We have quite a broad array of programs for veterans and active service members. This is one of our veterans workshops, and we offer a whole host of programs for people with Parkinson's disease and movement disorders, 5 classes per week in dance, singing, and art. And so I'll just bring your attention back to a moment to a different view of the program to note again this really unique marriage of the Center for Arts and Medicine and the UF Health Shands Arts and Medicine program. And you'll see that the people who are involved in the program span all of those areas of our purview that I just described, from research and education to outreach, clinical services, and the environment of care. Our faculty and our artists and residents both serve all of those areas. Many of our faculty are artists and residents, and many of our staff also work as artists in the program. So together, all of those individuals are accomplishing a very unique approach to providing the clinical services that I just described, and also to researching and evaluating those programs. I want to take a moment to share just one example of our research. We have about 12 clinical studies going right now. And this is one that we're very excited about. It's one that is supported by the National Endowment for the Arts, and it's a study of live preferential music in emergency and trauma medicine. There's quite a bit of literature that shows that music in particular has a tremendous impact on reducing stress and reducing anxiety and even in reducing pain. And we were wondering if music in an environment as complex and challenging as an emergency and trauma unit could be positively impacted. So we're studying the effects of live preferential music on pain medicine utilization, on overall cost of care, and on satisfaction. So we're in the 3rd phase of this study right now. We started with a unit level study, which helped us determine the power of the study. Then we did a 2nd phase where we consented 850 patients to an intervention in a control group, and we had some very exciting outcomes from that study. We were able to demonstrate that patients who had live preferential music were able to utilize significantly fewer pain medications. So morphine and morphine equivalent utilization was significantly reduced, as you can see on this slide, among people who received the music intervention. And you've heard me use the term live preferential music. Just want to clarify that that for us means that the patient is able to specify what type of music that they like, and the artist is able to respond to that. And so that's a specific component of our study that we're particularly excited excited about. We were also able to document very significant reductions in blood pressure, both diastolic and systolic blood pressures, and we were able to see those effects sustained over time. Up to 6 hours, those effects were able to be sustained, and they were also seen around hypertensive patients. So those outcomes are very exciting for us. We've also seen reductions in length of stay, and we're still doing our statistical analysis to be precise about how much of a length of stay reduction we've got so far. And as I mentioned, we're in phase 3 of that study right now, in which we're focusing most specifically on pain. So that whole picture, I hope, creates an image for you that represents that this art program, again representative of many in the United States, has really created a change in the culture of care. In our hospital, the arts are central not only to our environments, to the design in the environment, but to the way that care is provided. Our artists are part of our interprofessional teams. And I'll note what you see here is, again, our Children's Hospital lobby. When this tower was opened, the CEO welcomed everyone to the new tower by saying, "Welcome to the marriage of science, technology, and art." And his script for the opening of our new tower, which is coming in a couple of months, is to welcome people to the marriage of science, technology, art, and nature. So we're very excited to see that art has also driven a focus on nature in the culture of our healthcare environment and has produced a healthcare setting in which artists are highly valued and the arts are central to our approach to healthcare. So I will pass it over to Patricia now. Thank you guys very much.
Well, thank you very much, Jill. You've given our webinar participants some great insight into one of the most comprehensive arts and medicine programs in the United States. If any of you have the chance for a site visit to Jill's program in Florida, it's a very inspiring experience. Now that you all have a good idea of what a comprehensive arts and healthcare program looks like, I'd like to share with you some pathways to either get started in this field or to expand your engagement in this field. I'll start by briefly mentioning that the perspective that I bring to this presentation is that of a professor. I've led development of a graduate-level program of study and a research trajectory within the University of Oregon's well-established arts management program. I also serve as an ambassador for the National Organization for Arts in Health, which is a professional association that I'll be referencing throughout this presentation. I noticed on the participant list for this webinar that there are quite a lot of you who represent foundations and public agencies. If you are interested in developing this field as a whole, either nationally or within your local community, I'd urge you to consider investing in serving the field and advancing the field. By serving the field, information and communications of all kinds are needed. In advancing the field, there are specific areas of investment that you could consider, such as initiatives that provide training and technical support. Research is a great area for investment, and the field is wide open for research of all kinds. Jill gave an excellent example of this. You could also invest in creative practice throughout the field. There's currently a lot of innovative growth taking place in engaging the arts in community health or public health initiatives in particular. This presentation would not be complete without pitching my book, Managing Arts Programs in Healthcare. For those of you who are interested in beginning or expanding arts and medicine programs, this book will be a great starting point. It also serves as the foundation for much of what I'm discussing with you today. Jill has shown you the field of arts in healthcare, it's also referred to as arts in medicine, in practice. Here is a definition of the field that was developed some time ago, but still works well for communicating the scope, the importance, and the impact of what arts in healthcare can do for institutions and communities. You'll notice that this definition starts with stating that arts in healthcare is dedicated to transforming the healthcare experience. As we all know very well, our nation is in a period of massive healthcare reform. In addition to the ongoing national policy discussions, there are several important trends in healthcare to be aware of. All of the trends listed on this slide are contributing to an expanded role for arts in clinical settings. The big takeaway from this slide is that healthcare consumers are expecting a much different medical experience than they did in the past. In fact, the patient experience during their stay has become so important that many medical centers now have patient experience officers at the senior administrative level. Another important thing to be aware of is the national movement to pursue the so-called triple aim of better health, better patient care, and lower cost. The arts can help institutions address all of these trends very cost-effectively. In short, investing in arts programs in a healthcare institution is a good business decision. In the program overview that Jill provided, you saw a comprehensive array of services provided throughout a continuum of care, ranging from creative arts therapists on one side to more general artists in healthcare or artists in residence on the other side. For those of you developing programs, it's important to be familiar with the professional qualifications and scope of practice for these various fields. Where creative arts therapists are mental health professionals who provide clinical services, artists in healthcare are focused more generally on the environment of care and the patient experience. There are actually 5 major areas of focus in this field as a whole. The arts can be part of patient care, which includes both clinical care and the patient experience. Architecture, design, and the arts can be an important part of the facility's healthcare environment. The arts can be used very effectively in self-care and wellness programs for caregivers. The arts are being used in many of America's leading medical schools to enhance medical education. For example, by engaging the visual arts to teach visual acuity and observation skills. And the arts are being used increasingly in initiatives focused on community health and well-being. In other words, you have a lot of options if you're considering developing programs in this field. In order to develop a sustainable arts and health program in a medical center, you'll need to have dedicated leadership, funding, and administrative oversight. Ideally, the facility will hire a healthcare arts administrator. This kind of position has many different titles. Most commonly, though, arts and health programs begin with a portfolio of responsibilities being placed somewhere else in the institution. In most cases, a person who initially has this portfolio doesn't possess specific expertise in managing arts programs and initiatives, so there really is a big need for professional development here. Let's turn now to some specific steps that you can take to introduce or develop arts in healthcare programs. The first step is to figure out what type of arts programs, services, and activities you're interested in developing. A major consideration here is whether you'd like to focus on the healthcare environment or on participatory programs or both. But let's quickly go through a range of program options in a series of charts. In each of these charts, you'll see the overarching type of program, various types of programs that you could initiate, and who these programs typically serve, whether that's patients or patients' families, staff members, or the community at large. This first slide addresses the creative arts therapies. Here, we are looking at what is a very common area of initial investment, which is visual arts displays at the institution. There are also a lot of options that engage landscape architecture to create healing gardens and wonderful ways to integrate the visual and performing arts into these settings. Still focused on the environment of care, you could also invest in performances in public spaces. A common low-cost investment to start an arts and health program is to hire musicians to play the piano, harp, or guitar in public lobbies. If you're interested in investing in arts programs that enhance the patient experience, you're most likely looking at bedside activities. There are many wonderful program options that engage visual artists and performing artists. Or you might be interested in developing arts programs that support the wellness of your institution's staff members. This is a growing area of concern and investment due to the high rate of compassion fatigue and turnover that facilities experience. Investing in arts programs for caregivers can be a very cost-effective way to enhance the institution's ability to recruit and retain excellent staff. As you're considering different program options, I'd urge you to look at several resources. The National Organization for Arts and Health has an interactive map of programs available online for you to search through, and it's continually being updated. There will also be a national white paper released in September of 2017 called Arts, Health, and Well-Being in America, and this will contain many wonderful examples. A digital version of this white paper will then be uploaded onto the NOAA website later in the year. And then there are some additional book recommendations on this slide that would also be helpful as good starting points. As the second step, once you've figured out the program or program types that you'd like to develop, you'll need to inform yourself about the professional qualifications and credentials required for the program. A great example of this can be found among musicians. Only credentialed, board-certified music therapists can engage in an official music therapy program. That is, only they can refer to themselves as music therapists. But there are shorter training programs and an increasing array of credentials that are available to professional artists interested in working at the bedside. And these programs are more focused on the patient experience. It's also wonderful to work with local arts organizations or universities to have live music in the general healthcare environment, like bringing in musicians for the main lobby of the institution. The third step is for you to build your team. You'll definitely be able to find champions among your physicians and nurses. There seems to be a close affinity between the arts and medicine, so you'll certainly find some support for your ideas. You'll need to secure champions among your senior leadership too, and you'll need to build coalitions and alliances throughout the institution as well as among your local community. All of this involves ongoing education, advocacy, and communications. Then you're ready to develop and introduce your arts and healthcare programs. A lot of careful thought needs to go into your program design, but there are many resources that can help you with this. The resources that I shared with you in an earlier slide will help point you in the right direction. I'd also urge you to contact someone who oversees a program similar to the one that you're developing to ask for advice, and the National Organization for Arts and Health can help facilitate this process for you. People in this field tend to be very generous in supporting each other, so please don't hesitate to reach out across the nation. There's a lot more that I'd love to share with you about this wonderful and growing field, but my time for this presentation is up. I know that we have some time now for questions and answers, and I'd also be happy to make myself available to any of you for questions that might arise after this session. Thank you very much, and I will turn it over to Janet Brown now.
Thank you, Patricia, and thank you, Jill. Really fantastic presentations by both of you. We have some questions here, and I'm going to turn to Jill for sort of some of the details and specifics about operations and working with your artists and your team of residential artists. So if you could just tell us a couple things. In general, how do you get, how is the support for the program? How do you pay for the support for the program? Is it your responsibility or the program's responsibility, or has it been assumed within the whole hospital's budget? And secondly, talk to us a little bit about how you treat the artists. Are they, and this might be nitty-gritty, but we all need to know these things. Are they contracted employees? Are they employees of the hospital? Are there any folks who are full-time? Are they part-time? So give us a little bit of that operational information, if you could.
Great, I'd be happy to. So in regard to your first question, our program has a pretty broad and diversified range of support. So the clinical side of the program, the department of the hospital, is supported by a hospital budget. So we get a primary budget each year from the hospital, and that budget pays the majority, but not all, of what we pay our artists. It pays for our administrative staff members, and it gives us miscellaneous money like for travel and supplies and those sorts of things. We also have some annual grants that we're able to rely on. We have a wonderful relationship with the Division of Cultural Affairs in Florida, and we've been very pleased to receive grants each year from the division that help contribute to artist and resident support as well, and we have annual funding from the Children's Miracle Network that provides art supply money for us. We were really thrilled that in the early years, the very first CEO who was leading the institution when the program was developed created an endowment for us with his $100,000 to start of his own money. And he was very active in cultivating other donors to that environment, or to that endowment. And that endowment now contributes as well to the support of artists and residents. And we also are fortunate to receive support from grateful patients, from individual donors. Our artists and residents are contract employees with the hospital. Our program started at a time when there were a lot of cutbacks and layoffs happening in healthcare. And so that was an agreement we made with that early CEO, that we would keep artists as contract employees so that as healthcare dollars ebbed and flowed and cutbacks were required, that the support of artists wouldn't fly in the face of needs to cut back clinical staff. So they are all part-time at varying levels. Some do as few as 10 hours a week, and some do as many as 30 hours a week. We really want our artists to maintain their vibrant professional work outside of the hospital, and also to maintain a high level of self-care. All of our artists participate every week in a 2-hour clinical rounds meeting, where they're giving reports on their clinical work and where we're addressing issues that help develop and advance their practice. So that's a major commitment we make to the program as well, and to the support of our artists.
Great. Thank you, Jill.
Mm-hmm.
I also think that there, people are scratching their heads out there going, how do I get this started? And I know that it's hard to go back 30 years and say, and you've talked about this, a particular leader who had leadership within the hospital who was supportive. But were there like milestones along the way, or I mean, how did the program get its foot in the door? And then were there milestones where you felt it went from we're kind of outsiders being in here to now we're insiders and part of the institution?
There really were some critical moments. In the first couple of years, we got a grant from our medical guild to do our first major installation, and somehow we got the hospital to agree to give us the walls of the main lobby. I think they might have thought it was temporary at the time. But we were able to create what's now referred to as the healing wall, and it's a type of installation that's really a mainstay at hospitals. Many hospitals develop these projects. We asked patients and family members and staff over a year's time to paint 6-inch ceramic tiles, and then a mosaic artist installed those tiles in our hospital. And what that wall did was it brought the human experience into the physical environment. So now when people walk in our front doors, they see art that represents the lived experience in that hospital, and it resonates humanity. And it also delivers the message that the institution cares about the people who walk through the doors. So when that installation went up, I think our hospital leaders were surprised to see the response from the constituents, from the people who walked in the doors, especially from patients who felt differently about them as an institution. They got a message that the hospital cared about them and was willing to invest in something that could feel like an extra in order to make it better. So that's when we first got our first annual budget. So that was very, very significant. And then over the years, I would say the program, like the discipline, has evolved from feeling like, well, that's kind of strange, what's happening here with the arts in healthcare, to it's really, really nice. And now that we have a clear body of research, we have professional and educational programs happening, people are credentialed and trained to do this work, we have a clear scope of practice, I think the field is being viewed as much more important now. and that's certainly the case in our institution. We're not viewed as an extra, we're viewed as an essential, and that I think is pretty amazing and exciting.
Well, it is pretty amazing and exciting, and it's what makes the program really a model for others, although, you know, many decades in the making. So the hard work begins at the beginning, right? And with trying to find allies, I think, as Patricia talked about. So Patricia, I want you to think about, maybe answer this, and Jill, if you also would like to chime in. I think that there are, that we're focused on professionalism. So Jill's talked about certification and that kind of thing, certification for artists and residents, as well as the music therapy, and Patricia's talked about the difference between the two. But what does really professionalism mean with respect to this field, and why is it something that needs that we need to consider? And what are the things that we need to consider when we want to focus on that, particularly with training or supporting artists?
That's a great question. Thank you, Janet. And I think Jill started to refer to this in the response that she just had regarding the program, and how it has evolved alongside the field of arts and healthcare as a whole, where what we've seen over the past several decades is development of a body of research and robust educational programs for the field and credentials and a scope of practice. Now, there's a lot of work yet to do in this area, but these are all markers of a process of professionalization. And so that's very exciting for the field as a whole. It's important for the field because credentials and scope of practice, codes of ethics, and all of these qualifications and considerations are absolutely crucial to all professionals working within a healthcare setting. And artists should be no exception to this. They're working very closely with patients in vulnerable situations. There are a lot of legal considerations at play with HIPAA and the like. And so there's a lot to take into account in ensuring that the artists who engage in healthcare settings have the background, the training, the ongoing supervision, and the support to be professional in the work that they do. And once again, I think that Shan's program is really a model for how this can be overseen. My argument and really the prompt for developing the book, Managing Arts Programs in Healthcare, is that professionalization of the field as a whole, as well as the artists working within the field and the programs and initiatives, really can't take place without professionalization of the administration. So the field needs professional leadership and administration where there are specific knowledge areas and competencies and skills in order to successfully develop and implement and sustain these programs. And so my major focus has been on the administration side of the field, and I know that the National Organization for Arts and Health is also very interested at this point in overseeing a national movement that's well underway to credential both artists and arts administrators to work in healthcare settings. So it's very exciting to be part of this formative stage of this professionalization process.
Great. Thank you. And for both of you, too, are decisions made to integrate the arts in healthcare? I mean, most of our healthcare systems are our hospitals and clinics are part of a bigger system. So are the decisions made at the system level, or are they made at the hospital administrators level, administration level? So, so how would one go about, do you start with your corner, the hospital on the corner, or corporate headquarters, I guess?
So I'll start with, sorry. Go ahead, Jill.
No,
well, I'll start from a big picture perspective and looking across the country. Both models exist, and you find really exciting, innovative arts and healthcare programs both within small, very regionally oriented institutions, also within rural environments. and you find wonderful programs at the system level within major, especially university-based medical school institutions. And so I think that both are possible. So you really have to know your own local institution and develop relationships within that institution. But Jill, I think perhaps you can provide a great perspective, again, from Shan's on this.
Yeah, I agree with you, Patricia. It really does happen both ways. I think I've maybe seen more examples of programs moving from a single hospital to a system-wide implementation, and I think that reflects something that we see in the field as well about how programs tend to start. They often start through demonstration projects or through pilot projects. We see that often there's an individual, it may be a community artist or a care provider in the hospital or a social worker in a hospital. It really could be anyone who has the idea to bring the arts into the hospital, and quite often they demonstrate that potential to the hospital or to the system by doing a defined project, maybe a 3 or a 4 month project, something like the Healing Wall project that I mentioned earlier. And then they're able to demonstrate the value of the program to their institution. One other thing in that regard that I want to share, we had an interesting moment yesterday morning. We're running our annual Arts and Medicine Summer Intensive right now, and our CEO came to welcome the participants. And he said something from a CEO's perspective that took me back to the CEO roundtable that we held quite a few years ago. It was a national roundtable of major hospital CEOs in which we asked, why do you support the arts in healthcare? And we went into that meeting thinking that they were going to talk about, cost investment, that the arts are relatively inexpensive in regard to other healthcare costs, and that they, can potentially reduce the cost of care, and they can reduce length of stay and reduce medication utilization, things we see in the research that we assumed would really matter. But what our CEO said yesterday in his welcome was the very thing that all of the CEOs had said in that meeting. And they said they do it because it's something that they can do to make it better. It brings meaning to their work, and it's the right thing to do. And I think from an administrative perspective, we often forget that while our administrators are looking at the bottom dollar of cost and accountability and quality and satisfaction and all of those things, they're also just trying to make it better and feel that they're making a difference in the world and to have a sense of meaning in their job. And so he reminded us all that drawing administrators into that conversation of can we do this and should we do this needs to be approached not only from kind of a research outcome perspective, but also from a more humanistic perspective of you can make a difference. Let's look at how you can make a difference. So that I thought was an important reminder.
That's wonderful, Jill, and it also reflects the larger conversation that's taking place across the United States looking at arts advocacy and the importance of advocating both for the intrinsic benefits of arts, which is exactly what you're talking about, that it brings individual and collective meaning and purpose and is so important to people in so many ways, as well as the instrumental benefits such as the health benefits, economic benefits, and community development benefits that the arts can provide. So I guess my argument here is to embrace both avenues for advocacy and for communications within the healthcare setting.
Absolutely.
Yeah, that's great. I also think that there is, having done some of these programs myself, that there is also a something that we need to, and I'm sort of wrapping a couple questions into one here, something that we need to think about in terms of how we present this to the medical community who maybe isn't familiar with it on an institutional basis, because we know that people are familiar with the arts on a personal basis. There isn't anybody who doesn't do some kind of art or appreciate it, listen to music, whatever it is. But on an institutional level, they haven't made the connection yet. And sometimes I think the fault lies in our interpretation of what we're doing and our kind of forgetting that in this environment, whether it's hospitals or clinics or whether it's corrections or no matter what kind of other cross-sector environment it is, that the arts are there in service of their mission. their mission of making people healthier, and the objectives that Jill cited to begin with, of a healthy people and having the costs be lower and giving great care. So so if we couch our language in that language, in their language, it becomes a different kind of communication than if we come in and say, we've got this great arts program for you, and we've been doing it over here, but it'll fit in here too. And but that reasons why is really important in terms of the goals of the institution that you want to be partnering with. That your goals become their goals, and you can help them to reach those goals through these arts programs and through artists. I'm not sure I want to end on this question, but I think this is an interesting question. And Jill, I don't know, or Patricia, if you have examples of how this works. I mean, so the country is having, of course, as we all know right now, a huge debate about health care and how that's all going to come down. We don't know, but certainly one of the biggest crises and issues for individual artists these days is healthcare and the availability of healthcare. So are there programs, and ironically, this sort of seems odd, but do programs include some kind of healthcare benefits for these artists? And is there any kind of advocacy along those lines that either of you know about that we can make that a priority? This is sort of a wrench. Nobody asked you to talk about this today. So.
Yes, no. It's a really great question, Janet, and it's one that we've been discussing for many years in the field. We did, for quite a few years, provided health insurance for our artists when we could do so for them as contract employees, and some of our artists who also serve in an academic capacity are able to get benefits through the university. But because of the unique structure that I mentioned around our program, benefits packages don't come along with, of course, a contract structure. Our administrative staff are paid that way, and I unfortunately have to say that the two major surveys that have done in our field that have addressed this have shown that the majority of artists working in this field right now are contracted artists, and that's surveys conducted by the Joint Commission. And we just completed a mapping project in the state of Florida where we've documented 114 arts and health programs in the state of Florida, and we surveyed those programs about how they're structured and how they're supported. And we found, again, consistent with the national survey, that the majority of artists are contract artists. So you're quite right to bring this issue up, that they're not getting benefits. We do see that rates of pay, both nationally and the state of Florida, average around $35 an hour for artists who are doing significant numbers of hours as opposed to a single drop in performance. So rates of pay aren't minimum wage, but they also need to go up. And I think those are two areas of advocacy that need attention, and as our field does continue to professionalize, I think we're in a stronger and stronger position to really be advocating for those changes. And I also think that when certification is in place for the field, that things may change in that regard in terms of the structure of employment for artists in hospitals.
It's a wonderful question, Janet, and I think also very appropriate to Grant Makers in the Arts Forum. And I'll reflect on what Jill said, and then I have a few additional points. I agree that right now we're not seeing as much long-term long-term positions with benefits that we would really love to see in this field. With certification, with ongoing professionalization, and with an increase in professional administration of these programs, my hope is that with time you will see that artists will be contracted in the same way any other professional service provider in a healthcare center is contracted. I think a bigger issue has to do with the relationship between healthcare and healthcare insurance and artists. And of course that's a major topic for policy discussion and has been for years across the nation. We know that with artists there's an ongoing concern about living wages, and we also know that most artists have what we refer to as portfolio careers. And so we see that artists who are participating in healthcare settings have this as one element in their portfolio. So we're very interested also across the nation in looking at opportunities to find reasonably priced insurance for artists. There are some artist unions, for example, that provide access to insurance in this way, and it would be nice to have more opportunities for artists to access low-cost insurance. And then another really intriguing area for healthcare for artists is looking at very specific healthcare opportunities and institutions that are focused on professional artists and their very specific needs. A great example of this is the Center for Performing Arts Medicine at Houston Methodist Hospital. It's just a fascinating example of a clinic entirely devoted to the physical needs and the physiological needs of very high-level performing artists. So there's a lot to be considered in the relationship between healthcare and artists and healthcare insurance and artists.
Well, I think it demonstrates to us that we have a lot of opportunities in this field, and that in order to do, but with those opportunities come some responsibilities, and I think especially on the funders' part, that this is something that funders could. I'm glad you pointed that out, Patricia. That this is really something funders need to consider always, and I know that they do, and they take this very seriously about the sort of plight of artists, particularly portfolio artists who are putting many different jobs together to make one life, and health insurance is certainly a huge issue for them. So I think it's to keep that always in top of mind as we kind of look at these kinds of programs. I also think it might be for some nonprofit organizations an easier it may be something that that rather going through the hospital, a nonprofit might be able to do. And I don't know. I shouldn't be talking. I'm talking off the top of my head. So sorry, everybody. Maybe you shouldn't even pay attention. But there are certainly collaboratives or something that we might be able to help artists with. But I think the idea is that this is a topic that I'm really glad we talked about. I'm glad somebody brought it up. Thank you for the question. And I think that we always have to take that into consideration is if we're going to move artists into another field in which they are being a contributing positive factor in that field, then what does it mean to be a professional and certified and to have your have the kind of dignity that you should in terms of your own benefits. And so I think it's a challenge for us. There's no question it will be a challenge. It is a challenge today, and it will be moving forward. Yeah.
Sorry, Janet. This is Jill. I wondered if I could add one thought there.
Please.
I think it is such an important consideration, and I also see it as really exciting that we're thinking and talking about this today. It really makes me think and feel recognition that this field is here. We're long past the days where we wondered if this was going to take hold. The field is really here. It's not only a field, but it's a discipline, and we see that demonstrated through the existence of graduate degree education programs, through dedicated field journals, through a body of research, through a rapidly growing number of people who are looking for training, and that is reciprocal with the number of opportunities that are available for artists. And I think it's important to remember that at this point, that the field really is established and that these kinds of dialogues are not only important in moving the field forward, but signal what the field has accomplished. So I really appreciate that question. And I certainly worry about that issue, but also this conversation just makes me feel really good about where this field is.
Absolutely. I mean, I think with more development and more sophistication comes more challenges, and the fact we can even talk about them makes it really exciting. And I'm just really pleased that I think our time is about up. I'm really pleased that we've been able to offer these both of these really learned people and experienced folks who have worked in this field for years and who know a lot. I also want to thank everyone who asked questions or everyone who was on the webinar today, and remind you too, as Jill just says, that this is a field that is in operations. It may not be in operation in your mind, in your organization, or your community, or your neighborhood, but there's a lot of research out there. There's a lot of statistics. There are a lot of arguments. There are wonderful examples. And I would encourage all of you, if you need more information, to please educate yourself about what really is out there, because it is exciting. And Jill is absolutely right. This is happening, and we can either help artists to help programs to be more artist-centric, and or wait for it to happen through somebody else. And I think in all of our areas of cross-sector work with grant makers in the arts, what we find too is this challenge, and I'll just leave you all with this, is this challenge about whether this is an art program or a health program. And those of you who are seeking funding will also understand the dilemma of that. And so as our field matures, I think to realize that there are so many benefits, and artists make their livings in so many different ways, that this is one more opportunity for artists to do that. And that it really is an arts program. It may be within a hospital or within a clinic or within a healthcare setting, but it really is an art program. So, so with that, Patricia and Jill, thank you very much. For everyone who is considering and joining us or coming to, I hope you all are, if you're a funder, coming to our conference in Detroit this fall, I hope you'll consider attending a session that we've planned with Jill and her University of Florida colleague, Tina Mullen, as they share more on their research that's been, of the work that's been happening at Shands, and they'll have more results than, probably than what Jill shared with us today. We'll be sending out links to today's recorded presentation, a PDF copy of the slide deck, and brief feedback survey. Please fill out the survey and send it back to us, because we like to know whether what we're doing is good or can be improved. And I want to thank you again, all of you for joining us and for having an interest in this really important area of opportunity for the arts and artists in all of our communities. Take care. Have a great week. Bye.